Do you like sex?
Do you know about sex?
What about safe sex?
STIs?
Healthy relationships?
In this series, we're going to be giving you a sex ed class unlike any you've ever had.
So strap in.
Don't forget to wear a condom.
And let's talk about
sex!
What is an STD? What is an STI?
And what do you think is the difference between them?
For sure. So,
sexually transmitted disease,
It's like one that you have forever.
sexually transmitted infection.
Whereas an STI can be treated by an antibiotic and can go away.
I don't really know the difference, to be completely honest.
There's only a slight difference between STDs and STIs.
Every disease starts as an infection. This means everyone who has an STD had an STI.
But if you have an STI, you don't have an STD.
An infection turns into a disease when it begins to change the structure and functions of your body.
HIV is an infection.
AIDS is a disease.
HIV attacks your immune system and weakens it.
Once your immune system becomes weak enough, you contract AIDS, the disease.
This is an example of how an STI leads to an STD.
Right now, in the healthcare community, health professionals are promoting the usage of the word STI rather than STD.
This is because of the stigma and the negative connotation attached to the word STD.
For the rest of our special time together, we're going to be using the term STI.
The CDC reports statistics for the 3 most common STIs.
These are chlamydia, gonorrhea, and syphilis.
Currently, there are more than 2 million reported cases of these in the United States.
This is the highest this number's ever been.
So, what do these STIs do to you?
Chlamydia,
It often has no symptoms.
and can cause permanent damage to the female reproductive system.
Gonorrhea,
It causes pain in your genitals.
and can lead to infertility.
Syphilis,
It starts as painful sores and rashes.
and then affects your internal organs.
If it's not treated, it will eventually lead to death.
The good thing is, all of these STIs can be cured.
In April of 2016, the Blue Banner wrote about an increase of chlamydia and syphilis cases here at UNCA.
Even though this followed a national trend, it shows how all college students don't know everything there is to know about safe sex.
Hey, that's why we're here.
Would you be embarrassed if you had an STI, or if a friend had an STI? Like, how would you react to that?
I definitely wouldn't be confident about it, though I probably would be embarrassed.
Having an STI or STD doesn't make you broken or dirty. They are treatable.
Everyone's so quick to slut shame people who do get these diseases or STIs.
I would try to take care of it and make sure it didn't spread to anyone else.
You can just learn from it and try to incorporate safer sex practices into your future.
So, if STIs are on the rise and some can lead to death,
How do you prevent them?
there are many ways to effectively prevent STIs, but it really all boils down to getting tested
Communicating with your partner,
and using protection.
So, number one thing is get tested. Even if you're with someone and you guys decide not to use safety, still get tested every couple months because you never know what they're doing or what type of relationship you guys are in. But get tested.
if you've had any kind of sex,
Or even just fooled around.
getting tested for STIs is important.
If you're in college, many health centers offer free testing.
And if you're not, you can still get tested for just a few bucks.
Getting tested makes communication easier, but how do you bring it up with your partner?
It's always kind of awkward to bring that up, especially when you're in the moment and things like that.
Yeah.
If possible, I would try to talk to my partner about it ahead of time, because when you're in the heat of the moment, it's really easy to just be oh yeah, I know I tested negative, and then really the next year wait, no, actually I didn't. You know what I mean?
There needs to be that moment when you're going into it that it's okay, are we gonna do this? Are we not gonna do this? You have to just go for it. Hey, have you been tested? Just bringing it up.
To say honestly, I won't judge you, have you tested positive? Because if you have, there are many different things you can do.
Yeah, some people may think it's a mood killer, but it's not. It's not gonna be a mood killer when you find out a couple months later that you have an STD. So, and you would have been so glad that you had that conversation before.
Information is power.
And that's why once you know, you can protect yourself.
Because with great power comes great responsibility.
The most common and effective way to prevent STIs is a condom.
But you can also use a dental dam.
These are used to prevent STIs when having oral sex.
It's just a thin piece of latex you place over a vagina or anus.
Or if you're in a rush, you can just cut up a condom and use that too.
As another form of protection, you can talk to your doctor about getting vaccinated for the most common STI, HPV, if you haven't gotten the shot already.
It's an entirely safe vaccine that can save you a lot of time dealing with painful warts and cancer.
Unfortunately, even the best of us get infected.
If you test positive for an STI,
It's not the end of the world. You're still human, and you can still live a normal life.
just seek treatment. That's all. Talk to your doctor. They'll know what to do.
Because most STIs are treatable and curable.
Don't be embarrassed.
1 in 2 sexually active people will contract an STI by age 25.
You're definitely not the only one.
So when we talk about sex,
We're also talking about pregnancy. Do you want to explain how all that happens?
I would love to.
Pregnancy is a pretty complicated endeavor from start to finish. It all starts with a sperm cell and an egg. Before even that, though, let's go over the parts of the female reproductive system. Here we have the uterus, the fallopian tubes, where the eggs travel through, the ovaries, where the eggs come from, the cervix, and the vagina. This sperm, this wiggly thing, is a microscopic cell that is created in the testicles. When someone ejaculates, it isn't just one sperm, it's like millions and millions of sperm. When someone ovulates, the body releases an egg and it travels slowly through the fallopian tubes for about 12 to 24 hours. It does this in search of a sperm. If a sperm manages to travel through the cervix and uterus and find an egg in the fallopian tube and fertilize it by connecting with it, then et voila! The egg is fertilized and the sperm has done its job. If the egg doesn't meet up with the sperm or manage to attach to the spongy wall of the uterus, it's shed out of the body with the next menstrual cycle. But what about the sperm who get lost along the way? I actually wouldn't worry too much since sperm can hang out in the uterus and fallopian tubes for up to 6 days. The now fertilized egg divides for the next several days, forming a ball of cells called a blastocyst. After about a week of floating and dividing, the cluster of cells attaches to the uterus wall and pregnancy officially begins. That pregnancy can continue for an average of about 9 months and then boom, a baby is born.
You see, the problem with sex is that it makes babies.
And who wants that?
It's the worst when you have a baby and you're not planning on it. So right now in your life, do you feel ready to be a parent?
No.
No.
No, my God. No. I mean, there are times, like, I think babies are cute. I don't even know if I ever want to be a parent.
No.
No!
Nope.
My mom and dad, they had me when they were 21, and that's how old I am now. And I just keep thinking about that. I'm like, oh my God, if I was having a kid right now, I wouldn't know what to do.
Oh.
And there are so many people who do that, who do have kids at such a young age. There's nothing wrong with that.
That's why there's plenty of ways to prevent pregnancy,
Like birth control,
which you can take as a patch, pill, shot, vaginal ring, or implant.
an IUD,
It's a little device that goes up in your cervix and releases hormones to prevent pregnancy.
spermicide,
It's a chemical that kills sperm, and you put it in your vagina before sex.
a diaphragm,
It's a little silicone cup that covers your cervix.
or to hell with it and get a vasectomy.
That's male sterilization.
Snip, snip,
But the most common form of protection,
is a condom.
and we're going to make sure you know how to put one on. First, check the expiration date.
August 2019.
This one's good to go. Next, open the package carefully. Bop. Hey, not like that. Use your hands, no teeth. There you go. Make sure the rim is on the outside, this way the condom can roll on. Then pinch the top of the condom and place it at the head of the penis. You're gonna wanna make sure you leave a little space at the top for the semen to go in. And the final step is to roll it all the way down to the base of the penis. And there you have it. You're ready to have sex. But what can you do if you have unprotected sex?
I think there's a thing called a morning after pill.
Right. After sex, sperm can hang out in your body for up to 6 days waiting to find an egg to fertilize.
When you take a morning after pill, your ovaries stop releasing eggs. So the sooner you take one after sex.
The lesser chance you have an egg to get fertilized.
But what if you're out of luck? What if none of that worked out?
You can get an abortion.
Isn't there a big debate going on about that right now?
There is.
Are you pro-life or pro-choice, and why?
I'm 100% pro-choice. God, I don't want to be offensive. I don't want to be like, I don't know why you wouldn't be pro-choice, but this is such a simple answer, but like it's your body.
So for the longest time, I was definitely pro-life, but just looking at like the movements going on and hearing like different women talk about their experiences, no legislative should tell a woman what they should do with their body.
My pro-choice opinions are mostly for like the very, very early trimester and very soon after conception. After that, it gets to be more of a gray area.
Women should have that choice if they want to have this baby, or if they want to put it for adoption, or if they want to have an abortion.
You know, it's just a bundle of cells, and so.
If you choose to get an abortion, you'll have to check the laws in your state.
Because a lot of old dudes in our government want to tell you what you can and can't do with your body.
And conservatives and liberals will always argue about whether abortion is right or wrong.
So you may have to drive a few hours to get to a place where you can have a safe and legal abortion. So most of us growing up had some kind of sex ed.
Your parents probably told you something.
Or your school had some kind of censored program that only taught you about abstinence, and whenever the word penis was uttered, someone laughed.
Penis.
Penis.
Penis!
But most sex ed in America is not adequate. What was your sex ed experience like growing up?
The school itself didn't do a great job about sex education. I remember like we mostly talked about postpartum depression. Like when we like learned how to put on a condom, it was like on like a random person's like random classmates like fingers that were like together like that, and so it was like really, really weird.
So growing up, it was very like typical, like they talked about like mostly regular heterosexual sex. You know, for homosexuals, they didn't talk about safety, things like that, but it was always based on abstinence.
What I remember is she just had a banana and no condoms. I think she forgot this. And she said the penis goes into the vagina and sex happens. And that's about it. And I had to kind of figure everything out on my own.
Trial and error.
Yeah.
They definitely needed to talk about using condoms, using safety, because that's definitely the best way,
Yeah.
for sure.
Yeah. Yeah, because everyone's gonna have sex.
Yeah,
Anyway, like.
exactly. If you don't teach that, if you don't teach using safety, and if you're uneducated, you're gonna end up making the wrong decisions and things like that.
That's one of the reasons we decided to make this video.
So leave us a comment.
Let us know what your ideal sex ed class would be.
Or how bad your sex ed was growing up.
And maybe we'll talk about it in our next video.
Thanks for watching.
And stay tuned for our next video on healthy relationships.
For more information, pick up a copy of the Blue Banner today.